Well, first of all, I want to wish all of you a happy New Year. Hi Jaime. We didn't meet in we did not meet in December. Digo, in what was it, in January? I think the virus was really at its aggressive perspective. Okay, and I felt that maybe it was better that we not meet. And so we didn't meet in January. So I know that the city made some concessions and we're meeting via video. So I know that some of you feel a whole lot more comfortable doing this. So I want to wish you all a happy New Year, and we'll move forward. And happy Valentine's Day too, because it was just 2 or 3 days ago. So I guess we can start first of all. I'd like to call the meeting to order. Today is February 15th, 16th, 2022. It's a Blue Ribbon Committee for People with Disabilities for the City of Laredo Mayor's Office. And so the first thing in order, the first item is to review and approve the minutes of December 15th, 2021. You all can take a look at those, or if you all have already looked at those, I'll give you all a few minutes so you all can look at those. Any changes or revisions that anyone wants to recommend or suggest? Corrections?
I don't know if I'd call it a correction. I think it may have been a misunderstanding on my part. I believe we discussed the possibility of writing a letter or drafting a letter of concern in regards to environmental factors in the air. We discussed that last time. But I understood that we were going to get a kind of like a framework, a guidance to be turned into user and with me helping out any way that I can. And I believe that's not what the minutes reflect.
Yeah, I had understood that we would be getting some kind of, I guess, skeleton that we could.
Yes, sir.
Just so that we won't like offend anyone in city council.
Correct.
That was more my concern about making sure that we didn't overstep our boundaries or our authority to speak on behalf of the city.
Yes, sir.
So I believe what our approach was, from what I recall in the meeting, I did share with the committee that we are moving forward with an application, a grant application to EPA that will provide additional resources for this type of air quality testing in our community. We are moving forward with drafting that grant application. I'm just finalizing details. We did receive notice that the deadline has been extended to, I believe, mid-March. So what I can do is get with the staff that's responsible for that grant. They can provide a framework for a potential letter of support, and then BRC can express their support through that letter for us to receive those funds and why it would be positively impacting our community. So
Excellent.
we will go ahead and work on that in the next coming weeks. I do apologize. We did have some changes within the structure of, the committee oversight and the liaisons. I know Tiffany has sent to you guys recently. She will now be providing all the facilitation for committees. And she has experience with this. She's been helping with our Drug and Alcohol Commission, with our Urban Agriculture Committee. Welcome, Tiffany. As you can see, she's very thorough with minutes and agendas, posting on time, but any additional support, she will also assist with that. So I'll have her work in the next coming weeks to facilitate some structure on the pending letters for the air quality, and also for the letters of recommendation for the additional members. We should see those coming to fruition in the next coming weeks. I know we had that pending as well.
Thank you. Did y'all receive the forward? I sent you all her resume, Amy's
Yes,
resume.
I did receive it. Thank you.
But was it, Dr. Ruthinger, was it a complete resume? Because I only got the first page. Or was
Oh,
it?
you only got the first page. I'll send it to you again. No, it was 2
You know,
pages. As I
it
recall.
started with her work and then the experience or what was it? The issues that I think I only had the first page. That was it. Nothing else came. So I don't know if it was just me or my system.
It was a 2-page report, but I'll send it to you again. It's no problem.
Okay.
I'll do that
I
today.
appreciate that.
Thank you.
Okay, thank you. And just Tiffany, are you there? Tiffany.
Hi, sorry, yes.
Hi, how are you?
Yourself?
Nice to meet you.
Nice to meet you as well.
I know that I've had numerous conversations with you in the last several days. So yes, I agree with you, Erica. She's very on the ball. Okay.
Thank you.
Yeah. So thank you for sending out all the agendas and the minutes as well, and sending them again this morning, because I know that one of the things I know that everyone needs to do is go to a meeting and have to go back several weeks to identify where the stuff is. So thank you for sending those this morning. Again, makes it much easier for us. Thank you.
No worries.
And I haven't said hi to Ms. San Miguel. Did you send a text or something right now, a chat? Marta, are you there?
There she is.
Yeah. I think she's having issues with the audio.
Oh, okay.
Sometimes when you go to settings, it's just picking up like a different speaker, or you have to, pick the microphone. I don't know if she can hear us.
And Diana, you're extraordinarily quiet this morning. What's going on?
Sorry. I wanted to be the first one on, right? I said,
Yeah.
forever. And then I get called and I'm like, dude, I gotta be the first one on over here. But anyway, hi everybody.
Thank you for joining us. I mean, Jeanette, I haven't spoken to you, but I don't dislike you. You're still my favorite there.
I'm here. I'm just taking the minutes.
Cecilia, are you there? Cecilia. I'm going to assume you can hear me and you're just communicating with me. Okay. I guess we can move on. We were talking
I have
about
a question. I was not in the meeting last time, but on item number 4, letter D, line 3, is it Becky Morales for LISD? She's coming back?
No.
I'm reading it.
No, I thought it was Amy.
It says Becky Morales from the school district is a nominee. It's not Becky. It's what's her name? Right?
It was Rosa Denise. There was Rosa Denise Luna, and then there was a Miss Amy Casares, no?
That's correct.
Right.
Okay.
We need to have a correction there on the
Thank
minutes.
you, Emmett.
Yeah, and I read that and I was like, maybe something happened. I wasn't there. But no, I noticed that also as well. So thank you for bringing it up and confirming what I thought was wrong, probably. Yeah, we may have said something to the effect that she was replacing Becky.
That's correct.
Okay, so that may be been the issue.
So that's a correction also.
Okay, thank you. I mean,
Okay, what is the correction? I'm sorry, it's not Becky Morales, it's who?
Amy Cazares?
Okay, thank
Correct,
you.
Dr. Ruthinger?
Yes, that's correct.
Okay.
Perfect.
And then in regards to the letter, it's a personal preference, I guess. I hate to be assigned something and not be able to come through. So it was important for me to clarify that on the minutes, Mr. Chair and I were not supposed to write the letter yet. We were awaiting a framework and guidance from the health department before we moved forward.
Okay.
Thank you.
Thank you.
Yes, ma'am.
Are those the only changes or discussion regarding the minutes of December 15th, 2021? Jackie?
Hannah, is there
you?
anything
Hi.
else?
What was that? Dr. Ruthinger, did you say something?
Oh, I'm terribly sorry. I was just asking Jaime since he caught that
No, that's it.
correction,
That's all I saw.
if there was anything else. Excuse me.
Yeah, so we'll just change Becky Morales to Amy Cazares.
Mhm.
Okay, so if there are no other changes to the minutes of December 15th, we can move on to public comments. Did anybody sign up? No, right?
We did not have anyone sign up for public
Tiffany,
comment, Mr.
okay.
Chair.
Okay, let's move on to item 4, which is discussion and possible action. Report from Christine Reyes. Christine.
Good morning, everyone.
Good morning. How are you?
Happy New Year, happy Valentine's Day. A little bit of everything. I'm so sorry. My connection is somewhat poor, so I had to pick and choose either the voice or the video. So I'm just doing no video today, but I'm going to go ahead and report what our program has done since the month of January till now. Our program was able to share educational tips to help caregivers give their children on a routine and schedule, to keep them on a good routine and schedule in regards to transitioning back to school from the holiday break from December through the new year, and also with the recent change of the remote learning week. Our program has also connected during the month of January with Elizabeth Roeder, MD, who's an associate professor of pediatrics and molecular and human genetics. She's in the Baylor College of Medicine division. She's the chief of genetics from the Children's Hospital of San Antonio. We were connecting in regards to creating a proposal for a virtual webinar for OBGYNs, pediatric providers, and for our health coalition members for the end of the year. This is an initiative and a collaborative effort that I'm working with the Healthy Texas Mothers and Babies program. Our programs are in hopes to bring an educational webinar to our community. Of course, when more details are available, we'll share the information and also the flyer with the Blue Ribbon Committee. Our program continues to train and learn about government benefits for our children and young adult clients. As mentioned in our last meeting back in December, on February 1st of this year, services became available for Medicaid holders, specifically the ABA services. Our program has been able to share the information with families that are seeking the ABA information and education. We're also able to continuously guide families to educational resources for SSI, Medicaid waivers, and connection to our program state caseworkers. We've also recently connected with Partner Resource Network to collaborate in upcoming webinars and workshops that focus on transition, creative parenting, and understanding their child's and young adults' disability. These webinars are going to be hosted in the next coming months, and I will be able to provide those dates and times once they're established. During the COVID-19 surge, our program was able to connect with 179 program families. We provided each family information on flyers for vaccine drives and services, along with COVID-19 testing sites. Since our last meeting, the program was able to create educational flyers and videos that were shared through our VIA social media page. We provided information on how caregivers can help their child and young adult who has a developmental disability cope during COVID-19. Caregiver information on coping and staying strong, caregiver information on community support and services, information on clinic and therapy appointments. That was more of being able to educate the families on communication with the agencies, the right fit and type of face mask for the child with the special healthcare need, COVID-19 transitioning back to school, and how to prepare a child with a special healthcare need for a power outage. So these last 2 months, we were able to provide plenty of educational flyers and videos through our social media page. Of course, throughout this past month, we've reached 319 clients, putting our program at a 374% of clients served. And that is my report.
Christine, thank you. As always, you're very informative, and you seem there's a lot of. Am I bouncing back or what's going on?
You have an audio loop.
I have an audio loop.
Mute their audio if they're not speaking.
You all hear me?
Better.
Okay, I had my phone in front of me, so I don't know if that's an issue.
Christine, did we share about Autism Speaks? I'm sorry.
Okay.
I was going to be sending that on the email later on today, but I could also share the information right now. I was sent some information from Autism Speaks organization in regards to inviting stakeholders and community organizations to participate in a free virtual a webinar. I believe several speakers that are going to be on there represent Texas Workforce Commission, the neuro development specialists, on speaking about how to make the workforce inclusive and giving tips and information for the autism community. So I'll be sharing that email later on today and forwarding it to anyone that would like to register or invite other stakeholders and community organizations.
Christina, we have Autism Speaks on our website as a link, which provides good information. But I do not know whether we ever got the link to the videos that you guys have been using to inform the public. Did we ever link up with those on our website? Because I really would love to see those videos available on our website for the Blue Ribbon Committee.
I believe we have a YouTube page. I'll double check because I believe my supervisor, once I am done with providing the videos on our social media page, one of our representatives, I'll double check and make sure I cross my T's and dot my I's on this, if it's our PIO that uploads them to our YouTube page. But I will have an answer for you by the end of today. But I do believe we have several videos already uploaded in our YouTube that are from our past videos of Halloween and Christmas and some details on tips of sensory overloads.
You had some couple of months ago, actually, I want to say 4 months ago, you were sharing with us some great videos that y'all had used for the purpose of education, educating the public. And those are the ones that I believe I had asked if we could get links to them on our website, on the City of Laredo Blue Ribbon on our website. If it's
Follow up on that, Dr. Rosario.
Monday?
We'll follow up on that.
Thank
It's
you so
actually
much.
Carlos Ramirez from City Secretary that updates that link. I know they've had some staff shuffling over there, but
Understand.
we'll go ahead and follow up on those links.
Thank you.
Mhm.
Any other comments? Okay, Christine, thank you as always. But what do we do without you?
Thank you.
Thank you. You're always a very informative. Had a lot of information for us, so thank you so much. Move on to the next item is review and update on services for people with disabilities and any other new or additional services as a result of or in response to the COVID-19 pandemic. So I don't know if there are any other services that have been added or recently provided toward the population that we serve.
Well, Christina said 179 families were given info on COVID and COVID vaccinations. So
Okay, so that's the information we have then. Thank you, Dr. Ruthinger, for your comment or your observation, rather. The next item is discuss possible action, if any, to be taken by the committee to better protect the health of people with disabilities being threatened by the contaminants being released into the atmosphere. We had that discussion already, so we will wait upon Erica and I guess the city, the health department regarding that. The letter to
For the letter, yes.
A letter of support for the grant that's been written.
Yes.
Requested.
Mhm.
Mr. Chair, you and I need to work on that probably sooner rather than later because Erica informed us that the grant is actually due mid-March. So
Okay.
we need to pen our letter prior to make sure that it's included.
Erica, do you know if the city has an abstract or something that we can use?
We have assigned staff that has been working on the grant application. I know they met last Friday to provide a status and work with our budget team to see where we were at. I'll get an update from them and ask them to share any information with me so I can relay that to you. But like I said, we can probably provide the framework of the letter of support and then just put it on your letterhead and have you review, make the changes, and that way it will be ready to submit.
Thank you so much.
Sure.
Yeah, if we're going to do it that way, then I don't, Dr. Ruthinger, the reason I was asking about an abstract is I don't know if there are any details about the grant that you'd want to or we need to point out as a letter of support. Or do you think it's sufficient that we just write if it's just in a very general format that we're supporting the
Well,
cities?
if you like, we can perhaps cite some specifics from the research online and add, then run it by Erica and see if it's okay. Because like you said, the tone of the letter needs to be supportive, but we don't want to step on anyone's toes either.
Okay.
So I guess we should, if you want to add the specifics, we can, and then just have a review and let us know if that meets the criteria for support.
Because usually the abstract will just typically just indicate just requesting it and for what purpose, what the benefits might be very in general terms. So that's what somebody was asking about that. But whatever you can find for us, Erica, we appreciate it. Okay.
Yes, definitely. I'll share before the end of the week.
Okay. Thank you.
Thank you.
The next item is discussion and recommendations of possible new replacement members for the City of Laredo Mayor for his consideration and approval. Again, we just had that discussion regarding Amy Cáceres as well as Ms. Rosa Denise Luna. And so, Erica, did you indicate that you would provide us with a skeleton, or do we go ahead and move forward with that on our own?
For the letters of recommendation for
Yes.
additional members, yes.
Yes. Just
So we'll circle back to the resumes and the information provided on the candidates. I believe I had already drafted a sample letter, but we'll go ahead and
You
update it and send
did.
it
I
to your
remember
review.
for previous members, there was already I don't want to say form letter, but a well-written letter that was then submitted to our chair. And then Daniela and I just basically looked at it and sent it back because I believe you then followed through with submitting resumes and the like.
Yes, I think the letter was almost ready to go, and then Mr. Castillon did recommend that the resumes be included. So I believe that's where we're at. I will go ahead and look at it before the end of the week. I do apologize. There's a lot going on.
Thank you, Erica. And we know you're busy, so
We appreciate you,
doing
ma'am.
a lot of vaccinations and stuff.
No, thank you. Thank you for your patience, but we will get this going.
Okay. And I think that's the end of the agenda items. Number 5 is, are there any announcements anyone would like to make? No? If
I
not,
believe
we,
Jackie
I
wants
got-
to make an announcement.
yes,
ahead.
Jackie, go ahead. Can't hear you. You're muted. No, no te oigo.
There,
Yeah,
can you hear me?
yes.
Yes, now
Okay.
yes.
So I just wanted to let you all know that we continue having our successful pediatric ortho clinics from the UT Health Science Center. They seem to be growing, as I know Laredo is growing, I guess, and the need is there. So we're very grateful that we are able to continue these clinics. Also, I was contacted by City of Laredo Health Department, actually to I need to see if we can have them from, I think it's their team of promotion specialists, to have a booth here at the center. The possibility, we're just talking about it, maybe a day in March, and then also have their, I believe it's their mobile unit, and to bring awareness about the COVID-19. So I think that's an excellent idea. I'm glad they thought of the center, because we have possibly, we're seeing about 90 to 100 patients a day here for therapy services. So we have a good number of individuals that would benefit from this information. And also having the mobile unit here, I think we're going to discuss what type, and also they'll be informing of other type of programs that the city has available for the community. So I'm looking forward to that. I'm glad that the city of Laredo reached out to us, because we're always wanting to inform our patients and their family members about all the great stuff that the city of the health department offers. So I'll keep you posted on that. I'll send you all an email as to the dates. Thank you.
Yeah, the city of Laredo has quite a number of programs and projects that, I think that they get lost because there's so many of them. But if you ever go through their website, City of Laredo has the health department provides a lot of good services, and that's sometimes we don't know about because we don't go to their website, but it's quite comprehensive. So yeah,
Yes.
the city's done their job. Okay.
Thank you for that. If I could just add a little bit to Ms. Rodriguez's comment. Yes, we appreciate the partnerships. This is what makes a lot of our efforts successful, and we've seen it also at a state level when we do joint conferences or discuss our lessons learned and our achievements, is the value of our close knit community and how solid our partnerships are with other organizations. So we do have a mobile bus clinic now. It's a large blue bus has health department all over it. We're very proud of that. It does have the capacity to test for COVID and to provide vaccinations. We do have a program promotion specialist that will be out in our community. We have about 10 on board now. We're still looking. It's actually a team of 20. So if you know of anyone that's interested in joining our team, please direct them to our City of Laredo HR website. And that's what they will be working on is increasing our efforts, providing education on testing and vaccination, not only for COVID, for flu as well. We don't want, that comorbidity or coincidence of flu and COVID or any, a complication resulting on that. But we have the bus now. WIC has their bus. We understand other organizations have the ability to be mobile. Our vision long term, and hopefully once the numbers for incidents reduce a little more, is maybe again continuing to partner and do like a mobile village. Send all our mobile units to areas of town that perhaps don't have the access to come to our facilities and be able to provide services. So we're very excited of that. We just shared that with interim city manager yesterday. He was very excited about that effort. And I just wanted to provide all that additional information to you guys. But thank you so much, Ms. Rodriguez, for agreeing. And I know it's going to be a great event. Whatever you need, you can reach out.
Thank you. I'm looking forward to it too.
Erica, can I ask you a question regarding his residency? Does the City of Laredo provide services to? I know it provides services to Webb County residents. Does it provide services to people outside that area?
So there's certain
County
that we do.
James Hogg and Zapata.
It depends on the program. Back in 2011, we were in discussions for the update of an interlocal with the county. That was not successful, and they did decide to go their own way. So for direct clinical services, they do have their resources. I believe, they have some clinical staff on board and are looking to develop a county health department. But there are certain programs like in terms of surveillance, in terms of HIV testing, we do provide those services to outlying communities, but it does depend. I mean, our WIC services, we stretch out all the way to close to Corpus. So it depends on the program, but we try to be comprehensive with that as well.
Erica, if I may just give kudos to all the grant writers.
Thank you.
So many programs depend, of course, on grants.
It's a team effort.
My observation is if the services are out there, someone's been working really hard on those grant applications. So kudos to all of those people who gathered the research and put it together and plugged it all in and met that deadline. So
thank you. Yes, it's a result of our teams all taking ownership from anyone who's going to be involved in that particular program. Of course, with our budget team, we've been very fortunate to grow that team. We now have an additional budget analyst and a health grant specialist that will monitor not only the application, but the compliance after we do obtain the grant. Mm-hmm. Of course, administration is a critical role.
Yes.
Tiffany handles making sure that contracts are executed correctly, that they're notified, and council's notified about these funds. So it's definitely a joint effort with a lot of moving parts, but we're very fortunate that we have staff that's empowered to push through and to look for new and innovative ways to bring those resources to our community and continue to serve.
And it's no small task to get the research together from a myriad of different sources to be able to meet the criteria for the grant. So kudos all around and congratulations to everyone. And thank you so much.
Thank you.
Thank you.
Yes. This is Diana. I've got Well, one first thing is to share our condolences with Miss Jeanette, right? She did have a loss of a family member. So Jeanette, our heart goes out to you and your family, and know that we're praying for you and for strength and everything else. I understand you're back, right? You're back at the office.
Yes, ma'am, we are. And thank you so much. I truly appreciate that.
Absolutely. And the other thing is, I wanted to share that the WBCA, right? They selected the tribute to the medical personnel. So they've selected the hospitals, right, for the medical personnel to be the ambassadors for the WBCA parade. So that's exciting. That'll be on Saturday, the 19th. We will be the marshals for the parade. So they'll have the float with Doctors Hospital, Mercy Hospital, or LMC, and Laredo Specialty, and Laredo Rehabilitation. And then they're allowing 10 per hospital to walk and support and celebrate that honor, right, to be the marshals for the parade. So I did want to share that with you. I'm going to see if I can share just real quick this from the, tell me if you can see it. Can you all see that?
Yes.
Are you able to see it? Okay. So I'll just read it, right? They've got Laredo Specialty Hospital, Laredo Medical Center, and Doctors Hospital. Anheuser-Busch Washington's Birthday Parade Marshals tribute to our medical personnel. Join us as we honor and pay tribute to a multitude of heroes who continuously shine the brightest during Laredo's darkest hours. Laredo's own medical personnel have been selected to serve as the 2022 Anheuser-Busch Washington's Birthday Parade Marshals. The parade, which will be held on Saturday, the 19th at 9 a.m., is truly one of our most anticipated events of the celebration. The emphasis this year is to pay tribute to our local medical personnel, and we will be featured honorees from Doctors Hospital, Laredo, the Laredo Medical Center, and Laredo Specialty Hospital. As parade marshals, the designated representatives will serve as official WBC ambassadors on the day of the parade. The parade marshals and respective groups will lead more than 200 entries that participate in this grand event each year. So, I mean, us that are here from Laredo, I think it's a great honor, right? I mean, I'm sure they wanted to honor everybody because, of course, it takes a village. There were so many individuals involved, but here they're honoring the actual personnel that was on hands, you know, tending to the individuals through this COVID pandemic. So I wanted to share that with you all. Thank you.
Thank you, Diana. Thank you, Diana. And I agree that we should be honoring all the medical staff that helped throughout the pandemic, you know, all the hospitals and all their staff, doctors, nurses especially, worked endlessly, okay, to try to overcome the issues with the COVID. So, yeah, the hospitals do deserve to be honored in some way or another. Congratulations.
Yes, no, there's so many people, you know, that were in the trenches and speaking with the doctors here and the nurses. I mean, it was impactful what you know, what they were exposed to, and I'm sure many others, right? So we want to represent Laredo well, and hopefully job on Saturday. I did want to share one more thing. So Ms. Ceci and I worked on a success story to submit, if I may. Let me see if I have it here. Oh, here it is. I hope it's good quality. Let me see if I can share this with you. So we worked on a success story, right? For the Laredo Rehabilitation Hospital. As you all know, we're two hospitals. And I reached out to Reverend Gutierrez and Ms. Ceci to see if they would be okay, because he was a patient here for us to honor with this story. Tell me if you can see that. Can you all see that?
Yeah, but it's like micro-sized, so.
Is it? Is that better?
Yeah, that's better. Or is it I'm just too darn old to read it? I don't know.
I can see it really well. But anyway, I just wanted to highlight this because it's important, you know, for community to know that we were celebrating success. And of course, this is Reverend Gutierrez's story. It's an amazing story. And Ceci, I mean, you're here if you want to share the story. I mean, who better, right?
Well, I'm very grateful for I guess my husband being here, my beloved. I call him my beloved today because today is actually his anniversary. I told him, I said, I'm not celebrating your birthday on 27th anymore. I said, your birthday will be celebrated on the 16th of February, which is today. There was an error on the paper. It should say February 16, not January 16. But today is his anniversary for his first beginning. I tell him, I said, beginning of life, the beginning of a new tomorrow. So that's my daughter and my husband walking down the aisle. That was the biggest concern that he had and my daughter had, because he had the stroke in February. She was supposed to get married in March, and she postponed the wedding, believing by faith that he would be able to walk her down that aisle, and he did. And so we're very grateful for that. You know, medical personnel changes the lives of people. It changes the way you do things. And so it just gives it a new perspective. That picture right next to it, we celebrated our 32nd wedding anniversary at the hospital. And it was very unusual because usually we have a good dinner and stuff like that. This time the staff took care of us, not only physically, but emotionally. So we were very, very grateful for that. I'm appreciative of the time. And Diana, you did an amazing job, you know. So it's a time to celebrate. But I had sent a message to Mr. Castellon and saying that if I wanted, I could share something. I wanted to share that the city of Laredo, through the health department, has done an amazing job, not only saying we are here to powwow and have a meeting once a month on regarding people with disabilities, but they put basically their money where their mouth is. And I say that because we've been able to utilize talent in the city through the efforts of this committee and the efforts of Ms. Erica Martinez. So Ms. Martinez, thank you so much for everything. It really does make a difference. And, you know, to see the talent thrive in an environment where they are giving back. I always tell people, I said, it's not what you amass, but what you give back that makes a difference. And that's what you have left on your last few days. You know, when you're taking your last breath, you're thinking, man, you know, I really did something. And that's important to everyone. I know that I wake up in the morning and I think, okay, what can I do today to change a life? And I know each one of you does too. So to you all, to us as a team, to Ms. Martinez, thank you for availing the people that we love to work with to have a better tomorrow and to impact their communities and to feel like their worth is amazing. Because I can tell you, I'm writing those reports and I think about it and I'm excited. So thank you.
Thank you, Ceci.
Thank you.
It's been a partnership, Ceci, so thank you. And thank you for not giving up, and I don't give up either. So now we're, I think, reaping some of that success.
Yes.
And we're very fortunate. I mean, it's a testament in itself, just seeing seeing it every day. I see it every day. I work very closely to those individuals. Just their attitude, their willingness to learn, their excitement.
Yes.
It really we are reaping as much benefit as they are being in our team. So thank you for that. I did make it a point to try to obtain an update on the additional project we have in the pipeline, which is the student work or the work experience contract. I did receive notice. Carol did respond to Ms. Hassel. They are trying to finalize that agreement to make sure it gets pushed through. And hopefully in the next coming week, we can start seeing some sort of placement. So I won't let up on that either, just letting you know. And we'll continue to follow up on that until we have students in place that are getting their experience.
Yeah, to add to that, I did speak to I'm a bug when it comes to things, and I don't give up very easily. And they go, yes, Ceci, and it's okay, even if I sound like an annoying harp, because I think that it's all you need to do is knock, go in, to touch that hem and make a difference. And I did speak to HR from the city just a couple of days ago, and they said, were you the one that went for the MOU? I said, yeah, the one that was rescinded. Yeah, that was me. So they're working on it. And so I know that when they get push and a shove from every place, it's about building those bridges and not just acting with theory, but going with practice. Okay. So once again, thank you so much for everything.
Thank you, Ceci, for sharing your story. I think, for the most part, we seem to take our medical staff for granted. We never think about it until we need them. It's not until we need them that we know that our life depends on what they do, that they become very significant to all of us who have ever been in a situation where your life depended on some stranger that's pushing your gurney somewhere. And so it becomes really important. Through the pandemic, all hospitals suffered because the state of Texas hired thousands of nurses away from the local hospitals. And so they were in dire need of medical staff and nurses, and they were just not available because they were making tons of money anywhere else, okay? And so it's funny how the state of Texas siphoned all these people out, and then they had to come back and provide nurses and doctors to the local hospitals. And so all the local hospitals really had a very difficult time trying to fill those gaps and trying to fill them with the qualified medical staff to provide the services needed. So yeah, the hospitals have gone through a lot. They've learned a lot. And so, yeah, and your husband probably was ill during the middle of the pandemic. So, it was just like sheer luck that he was able to even find a bed, okay? Because they were just so difficult to find at that time. So I'm glad he's doing well.
Yeah, he's doing well, but he still can't race. I asked Diana to share one last picture before we sat down, and maybe she can do that. Just in September, we went out and we got together as a family. The picture on the right-hand side is my son, my grandson, and my husband racing down the hallway at a hotel. And Diana, can you read the caption, Diana? I can't hear you. Can you tell her she's muted?
Diana, you're muted. You're muted.
There you go, guys. Can you hear me?
Yes.
No.
Yes.
Sorry about that. Okay. So the right one says Reverend Tony Gutierrez racing with his grandson, Tony Quinto Gutierrez. And I asked Ceci, why Quinto? Because he's Tony the Fifth. I said, okay, got it. In September of 2024. And then guess who won? Tony Quinto Gutierrez.
That's right. So I think in life, everything's a race, and it really doesn't really make a difference who's first or who's last. The idea is that we run that race and we do it well. Because, we use the talents that God has given us to impact the lives of others. And I think that's what we do on a daily basis. So I know we don't give ourselves a pat on the back, but we do need to recognize that when you use the talent that you have, you can impact lives, and the reward you receive is amazing. I sit here today and I look at all of you in this forum, and I'm grateful for knowing you because I am a better person because of you. So thank you.
Thank you, Ceci. Okay. If there are no other comments or announcements, should we adjourn? Or you all just want to talk through lunch?
Yeah, I think. Well, after all, Diana's going to be walking the parade, so maybe not eating today would be a good idea.
That's funny.
Okay.
On my bike like a maniac. It's only 1.5 miles. I mean, I can do 3 miles on a bike.
I often give her what is it, an electric skateboard, and I'm not sure if she's gonna take it.
No, I'll probably hurt somebody or hurt myself.
Well, it's good that you have health community members that love you.
It'll be fun. So, it was good to see everybody.
Yes, it was.
Thank you. Okay.
Bye-bye.
Ceci, are you there?
Yes, I'm still here.
Okay, so after the meeting, can we talk for a moment?
Of course, we would love to do that.
Okay, we need to talk. I have information for you.
Did anybody adjourn or second?
Yeah, can we move to adjourn the meeting?
Mm-hmm.
Yeah.
So do I have a first motion and a second?
All motion.
Also.
A second. Thank you all. See you all next month. God willing.
Bye-bye. Thank you.
Bye.
Thank you, everyone. Have a good day.
Bye-bye.
Y'all stay safe.
Thank you.